Amy Max, Program Manager for the California Opioid Safety Network at the Center for Health Leadership and Practice, a program of the Public Health Institute. You are about to watch a webinar that has been condensed from its original format to provide specific content regarding ways to frame your message around opioid safety. During the webinar, we will provide an introduction to framing key messages around opioid safety, available resources and worksheets, and lessons from the field. The subject matter expert for this webinar is Lori Cappy, a communications and social marketing consultant from IE Communications. Let's get started.
When you think about communications, ask yourself these two questions: for what and so what? It's not about getting a story in your local newspaper or being interviewed on the radio or sending out a brochure. None of that is important unless you have thought carefully and consciously about what is the message you need to get out there, and as a result of getting that message, what will happen or change as a result. And once you're kind of clear on your objectives, your for what and so what, then it's a matter of who needs to hear that message, who is your target audience, who has the ability in the so what to move forward your agenda. And once you've got that figured out, then you have to think through what is the best message to get across that point, that for what, so what. And then as a result, what might be changes in actions if we're thinking about opioid safety? You know, maybe the action you want people to take is to do a drug give back or to do safe storage. Another so what might be to change the policy. So for example, maybe you want to get safe injection sites in your community. In the case of the Opioid Safety Coalitions, we all know that the for what, so what is to reduce both the supply and demand with the ultimate goal of preventing opioid overdoses. And we have three key strategies to get to that goal, and that is safer prescribing, access to treatment, and naloxone distribution. What do we mean by framing? This is just a straightforward definition, and then I'm going to give you a few examples as well. Framing is an important technique of focusing the attention of people within a broader context. How something is presented, in other words, the frame, influences people's attitudes and opinions. Framing is a form of agenda setting, the process by which a communication source defines and constructs a public issue. Let's think about that a little bit. All people come to new information they see or hear with ideas already in their heads about the way the world works. Those existing notions form kind of the mental structure or conceptual frames that allow us to integrate new information into our brains into a coherent way. So without even knowing it, we use frames to categorize information, identify patterns, and derive meaning. So frames do matter because they can foster certain understandings and hinder others. Often all it takes is a single word or image to activate an entire frame that then determines the deeper meaning of that word or image. Once activated, frames trigger emotions, associations, values, judgments, and causal explanations. In other words, they create the tracks for a train of thought. And once on that track, it's hard to get off. So when we talk about opioids, we do so in a cultural context that's actually rife with misconceptions about addiction, for example, shame, stigma for people with substance use disorders, and a sense that a crisis is devastating and anyone can fall prey to an opioid addiction. When we're thinking about framing, it's good practice to, before we come up with our frame, to kind of get a sense of what is the mindset of our target audiences. So if your target audience is the community at large, what might be their current context through which they're viewing things that we use to get a sense of the context is public opinion polling as well as media coverage. So I'm sharing up on the screen 4 bullet points about recent public opinion polling. Currently in 2018, and this is from the National Opinion Research Center, which is based in Chicago, so a very credible resource for public opinion polling. So 43% of Americans say the use of prescription pain drugs is a serious problem in their community. So the interesting thing, because NORC has been doing polling for, 50 years, they have a lot of trend data. And so this public opinion poll shows 10% increase just since 2016. That shows you that the public has become much more aware. That's a pretty dramatic increase. 3/4 of Californians believe it's very important for health plans to cover treatment for alcohol or drug use problems. 65% of Americans think people caught possessing non-prescribed opioids should receive treatment without jail time. Again, that shows a very significant public attitude that even for those who put into sort of the criminalized frame, that they believe that they should actually get treatment, that 53% of Americans view addiction as a medical problem. So that's a very hopeful frame that we're entering into this discussion about how to increase policies and strategies for opioid safety. We have a lot of coverage. Now, most of that coverage, when you do what's called frame analysis on them, will have the word epidemic. So the dominant way you're seeing all of these 1.3 national news results is through the frame of this is an epidemic, this is overwhelming, as well as quite a few stories on the collateral damage to communities. The other frame that we see quite a bit in the media coverage is about the rural communities being way harder hit. The notion that addiction is a disease also increased quite a bit, and we started seeing presidential platforms that were addressing opioids. A tremendous research resource is an organization called Frameworks Institute. They've been around since 1999. Because they have a great deal of resources, they're able to do a whole lot of multi-method, multidisciplinary communications research. What you clearly see in the media framing is that this crisis is devastating entire communities, and that ordinary people from all walks of life are falling prey to this epidemic, and it could happen to anyone. And we need life-saving medications on hand to prevent this. So now here's the idea of how to reframe. The reframe is that this is an issue that's going to require all the ingenuity we can muster. We need to work harder and smarter. And that's because these painkillers are prescribed widely and can quickly recalibrate the brain's reward system. And addictions can change over time, so must our responses. So now I'm going to go in a little bit more in depth in terms of how you would pivot from the current frame. I, as well, have been completely guilty of this in the last couple of years, is talking about opioids as an epidemic and a crisis. The more you hear crisis, you sort of a limited capacity for worry. When you're out in the community trying to get involvement, somebody might say to you, but should I work on this one, or gun violence, or, you know, what should I be working on? The reality is that for every one overdose, there are 100 opioid dependent users, people who are dependent on opioids. So how should we reframe it? Reframing this crisis to ingenuity. The notion that we can do it. We can restore and repair our community through a thoughtful and coordinated approach. I mean, the reality is that we're taking this thoughtful, coordinated approach of safer prescribing, which gets to early intervention and reducing supply. We're addressing this by saying, let's get the naloxone out in the community so we can prevent the overdoses, and that we need to promote access to treatment, which is evidence-based medical and behavioral response to addiction, and getting it into all settings, from the emergency room to the jails, and truly accessible to our rural communities. It's a really valuable reframe. Is the reframe from empathy to interdependence. And the personal stories frame that's been in the media, creating empathy with people who are addicted. But the problem with empathy is that it can sometimes reinforce fatalism about addiction. It can lead to a sense of, well, this is controllable but maybe not curable, or the damage done is the damage done, or some things are just too addictive, or even something about blaming the victim. And what we want to reframe that into is the notion of interdependence. Yes, we want to have empathy. We want to think about it as something that we can take collective responsibility, and that it is a problem that actually can be solved. The first strategy I wanted to talk about is safer prescribing. Our overall goal is to reduce opioid overdose deaths, and that one of our messages is the need for safer prescribing. That's one of our key strategies. So who needs to hear that message about safer prescribing? Well, in this case, the target audiences are physicians, dentists, health plans and providers, patients. The patients are a target audience because we need to manage demand by creating a more informed public. The idea of safer prescribing is that opioids are not effective for chronic pain. And that's been a message that for those of you who are curious about the data or the science behind that, I refer you to particularly the California Healthcare Foundation website, which has a number of excellent papers that address that. The other message is that there are alternatives for pain management. Mendocino County produced a flyer that they did in partnership with some of the local health plans that gives ways that you can manage pain. Now we're going to go to our second key strategy, which is access to treatment. The target audiences for access to treatment, as listed here on the slide, are physicians and primary care providers, and particularly a for what, so what there is potentially to encourage more of them to get an ex-licensing waiver so that they can do medication-assisted treatment. We also need to involve our behavioral health partners and pharmacists because MAT requires those partners to be effective. We want to talk to ERs and clinics because we want to encourage induction at those sites. And of course, we want to encourage patients who have substance use disorders and their families to access medication-assisted treatment in pretty much all settings. So those are the target audiences. The framing for this is that successful treatment is difficult, so we don't want to underestimate how difficult it is to overcome these addictions and the fact that these addictions many, many times, even with MAT, include relapse, but that a sustained multimodal approach is needed, and the earlier the better, but later can work too. So we want to be encouraging in the framing. Some of the messages are that it's a proven strategy, that it works, but there are gaps in treatment and more providers are needed in many of the rural counties. Treatment is not available to almost 90% of the people it could help. And where I put that little insert in our county, that means, and insert numbers and statistics, I want to encourage you to all look at the CHDF website. There's a really terrific tool there, but I also want to show you a few examples of the benefits of medication-assisted treatment for recovery. And so it has sort of the three key messages, that it reduces drug-related overdose deaths, it reductions in disease and violent crime, and improved treatment outcomes. The third strategy is naloxone distribution. So the target audiences for naloxone distribution are, again, the patients, in this case as well, pharmacists, people with substance use disorders, first responders, EMTs, and community settings. There was a story last year, which I believe was in Humboldt County, about a librarian reversing an overdose because she had naloxone. Naloxone is something all opioid users and their families should have. So in a way, what you're doing there is you're destigmatizing it. You're saying that, you know, just right from the beginning, when you get that opioid prescription, make sure you carry naloxone because, you know, even safe use can result in a potential for an overdose. So the Northern Sierra Opioid Safety Coalition distributed this flyer when they launched a community naloxone distribution program in partnership with all of the crisis intervention and resource centers in Plumas County. The first thing is that they had a key leading question trying to hone in on their target audiences, which is, are you taking strong pain medications? And then instead of using the word opioid, I thought this was kind of a good way to approach it, and then define it. All these medications are actually opioids. And then encouraging people to ask their provider for naloxone. So this is a good example of messaging naloxone access. We've had pushback on naloxone from some of our first responder agencies. And I know that's a tough one. It's sort of getting to the pushback I've been hearing for quite a while. It's the framing that people have that are you condoning addiction by giving somebody life-saving medication? The way to respond to that is through the frame of, addiction is a disease. And would you deny somebody an insulin injection? So there are many ways to use a metaphor to respond to that. Not to say that it doesn't require education. If you could get an EMS or a first responder or somebody who is on the front lines like that to be the messenger for that message, that would be all the more effective. The way you overcome that kind of pushback is to think carefully about the message and the messenger, and provide them with the facts, and the fact that is we have this opportunity for people to get a second chance or a third chance, or whatever chance they need, but they're going to be able to walk around in this world.
Thank you for watching this video. Please visit our website, CaliforniaOpioidSafetyNetwork.org, to access tools and resources, information on funding opportunities, and more videos in this learning series on opioid safety strategies and coalition development.